the architect's approach to mental health. 5 pillars of successful treatment. When we think of psychiatric treatment, the mind often jumps straight to a prescription bottle or a therapist's couch. While those are vital components, a truly effective recovery strategy is much broader. It is a structure built on several pillars. The more pillars you have in place, the more stable the building of your mental health becomes. While it is rare for a patient to implement every single one of these overnight, the goal is incremental adoption. Here is the modern blueprint for psychiatric recovery. 1. Medication, the foundation for stability. In the world of psychiatry, medication is often a point of debate, but the data is clear. For mild to moderate conditions, medication performs equally as well as therapy. However, when a condition reaches severity, medication becomes an unavoidable necessity to stabilize the brain's chemistry. Psychiatric pharmacology follows rigorous algorithms and complex rules to ensure efficacy. Because of this complexity, it requires a dedicated focus and a partnership with a provider who understands how to navigate these clinical paths. 2. Psychotherapy, refining the lens of reality. Psychotherapy is suitable for almost any diagnosis and, notably, has virtually no undesirable physical side effects. Think of it as a specialized form of mental training. Its goals are to improve reasoning and critical thinking, correct appraisals of reality, helping you see things as they are, not as your mood dictates. Social intelligence. It teaches you to become more observant of others' emotional states and how your behavior triggers specific reactions. Incremental modification. By changing your interactions step by step, you learn to navigate your community to obtain the results you actually desire. 3. Physical exercise, the natural engine. We often underestimate the neck-down approach to mental health. Studies consistently show that 30 minutes of daily rapid walking, or higher intensity, acts as a powerful catalyst. It doesn't just improve physical health, it directly boosts mood, increases energy levels, and provides the baseline motivation needed to engage with the other parts of treatment. 4. Absolute abstinence, protecting the process. A factor often overlooked, and one of the most difficult habits to break, is the use of disruptive psychoactive substances. This includes street drugs, alcohol, marijuana, and non-prescribed controlled medications. The rule here is absolute. These substances act as noise in the system, worsening the underlying condition and significantly decreasing the efficacy of prescribed medications. You cannot fix the engine while someone is pouring sand into the fuel tank. 5. Sleep, structure, and purpose. The final pillar is the lifestyle framework. This consists of 3 non-negotiables. Sleep normalization, aiming for 8 hours of continuous nocturnal sleep. The structure of activities, developing a schedule of activities that the patient attends every day. The power of purpose. A schedule without a why is just a series of non-functional rituals. To be effective, every action in your lineup must have a clear purpose behind it. Summary recovery is a spectrum. Patients will rarely be able to implement all 5 of these components perfectly at once. However, mental health is a game of percentages. The more of these pillars you accept and implement, the higher the probability of a successful long-term recovery.